Kitty. Thank you for being here today. Please tell us a little bit more about yourself.
Hi everyone. First of all, I'd like to thank Hills, Dylan and Mary for inviting me to this sharing session. I'm Dr. Kitty and I'm from Furiends Vet.
Okay, what do you do and how long have you been in this industry?
I started practicing as a vet since I came out from vet school. So it's been 16, 17 years since I started practice. But it's only in 2018 that I established Furiends Vet Clinic. I usually see mainly cats and dogs, and basically I'm like a general practitioner. So clients bring their pets to us for their general wellness checks and also basic sort of health checks, and we do some surgeries like sterilization, lump removals, dentals, etc.
And what sparked your interest in this industry?
I guess when I finished O-levels, didn't really know what I wanted to do. And one day when my mom went to one of those educational fairs, she came across the vet science course and she asked if I was interested. And that was when I thought, okay, might give that a go. Then my mom was also a stray cat feeder. So she used to bring home some kittens or sick cat during her feeding rounds. And I helped to care for them at that age. So I think that probably sort of seeded some interest, and that was how it started.
So the interest must have been really quite a lot, right? In order to be a vet in Singapore, we've said many times that it is not easy because there's no vet school. You need to go overseas, be away from family for many years, and it's also very expensive to study a vet school as well.
Yeah, so I guess it was more like mom gave that opportunity, and while it was a difficult decision, I think on hindsight it was a really good experience, and I learned how to look after myself, and I think I grow in a very different way because I got the opportunity to study abroad and learn to look after myself, learn a lot of things that you don't do if you're in Singapore because you're a lot more sheltered in that sense lah.
Yeah, I think it's definitely not easy to study overseas. Like I have a nephew that went overseas just probably about a month ago, and he's so homesick.
It will be lah. I mean, when I first went, because I was below the age of 18, I had to stay with a homestay family. I think I practically cry every single night there initially until I made friends. Then that was when things turned for the better lah. I used to call home almost like on a nightly basis. Yeah. But after that, I think once you got friends and you got someone else to share your thoughts and hang out together, then it all got better over time. Yeah.
So, do you have any particular breeds or species that you favor?
Well, I've always told myself if I can, I want to keep a Maine Coon, I want to keep a Sphinx. But breed probably doesn't quite matter to me. I still believe that basically if a animal becomes your pet, it's a little bit of a fate kind of thing. So not quite a concern for me lah.
Okay, and any particular area of interest that you have?
I guess I like to do a little bit of everything. But I like to do soft tissue surgeries at the clinic. And as a general thing, I just happen to see more cats at the clinic as well.
Back to the previous question about breeds and species as well, right? So do you have any pets yourself?
My husband always say I got too many. I've got quite a number of cats and one Singapore special.
Quite a number is how many? That sounds like a lot.
Sounds like a lot. Above 10 lah. Yeah.
Wow.
Yeah. But because I inherited some of the cats after my mom passed on, so sort of a little bit crowded at the moment, but not taking in any new pets lah at this moment. Yeah.
Do they all get along with each other?
it's hard to get everybody to mingle and socialize well. So we do have them separated in different rooms. Yeah.
Okay, so let's say a scenario, right, that your niece brings in a pet now. What are the 3 most important things that you would tell her as a pet owner?
So I guess one thing is to remember that a pet is for life, and you need to be financially, emotionally, physically ready to keep a pet. Keeping a pet in Singapore is not cheap at all. Veterinary costs does go up. Food, pet food, and things like that are also on the rise. Secondly, prevention is better than cure. So bring your pets in for regular checkups, vaccinations. This is when we might potentially detect certain illnesses a little bit earlier, or we can talk about preventive like oral care, dental health, and things like that to prevent incurring like a huge bill later on. Then I suppose lastly, just like us humans, if we eat a good, well-balanced diet, we exercise, we keep ourselves busy in our mind, we all live better and healthier. So same for the pets.
Okay. Yeah, I think especially like a pet is for life is very important. It's not something where Christmas and then we feel like want to get something and then just, or like during COVID we understand that because everyone was at home alone, so they got a pet, and then once it opens up we had an all-time high abandonment rate as well, right?
Yeah, because everybody got busy with their work, everybody go back to their usual routine, and then the pets might get a little bit more neglected lah.
Okay. Yeah. So let's move on to our main topic for today. So feline emergencies. So Dr. Kitty, what truly constitutes as a feline emergency, and how can pet parents learn to recognize the subtle signs?
Well, I mean, the pet parents are usually the ones that will see your pet on a daily basis. So you need to start knowing what's normal for your own pet. Every pet is going to be different. What constitutes as an emergency for one may not constitute for another pet. So, for example, like a single vomiting and diarrhea episode may not warrant immediate attention. For most cases, I would say you can wait 24, 48 hours to see if the symptoms worsen or if there's more symptoms that occur before you need to go to the vet. But you got to think about the situation. The cat is vomiting, but is the cat still alert, responsive? Is it still eating on the next meal? Does it look flat and lethargic? If they do, then it might require more urgent attention lah. But otherwise, everything else is normal. Just like one vomiting, you might just choose to monitor and not rush to a vet.
So what should be the first steps taken during these situations or when pet parents suspect that there may be an emergency?
Well, I mean, everybody will go to Google first lah.
Yeah.
Okay, so it's okay. You can try to match your symptoms with what Google says and then determine, do I need to really go and see a vet now? You can call your vet clinic, your regular vets, and you can speak to the staff there or the vet over the phone to determine, is this an urgent situation? Do I need to rush down now? But just be aware that over the phone, with the information provided and the staff at the clinic not being able to see your pet specifically, we can only give a general guideline and provide some information. So if in doubt or you just feel very unsure, you should still bring it down to the clinic. Nothing is more accurate than a physical check and look over lah. Yeah.
This podcast is proudly sponsored by Hill's Prescription Diet. Is your pet's digestive system giving them the blues? Loose stool and other tummy troubles can be negatively affected by many things, and when your pet has digestive upset, it's a thoroughly unpleasant experience for everyone involved. The good news is that you can help your pet feel better with Hill's Prescription Diet GI Biome. It is clinically shown to help firm loose stools in 24 hours. It contains a special blend of prebiotic fibers to help support a healthy microbiome, leading to firmer stools and healthier pets. Visit your vet to learn more about how Hill's GI Biome can improve your pet's digestive well-being. So usually emergencies are very last minute, right? So if pet parents were to call and say that, can I bring my pet down? Is the clinic usually able to accommodate that?
We will try, and of course, your existing clients do get a little bit more priorities. If we are really busy, we will usually advise over the phone to say, clinic is very busy, we may not be able to see. If you come in as walk-in, there might be a certain waiting time, but the pets will get triaged when they arrive. So a vet nurse will usually come out and have a look. If it really warrants immediate attention, something will be done. We'll bring the pet to the back, they'll start stabilization, they'll alert a vet. So waiting time can vary. And if we really cannot accommodate, we'll recommend you to call other clinics and check their availability. Because the priority is to get the pet the medical attention it needs. Yeah.
And you mentioned triage just now. Maybe you can also explain to some of us what is triage and what are the things commonly done.
So usually if we think that it could be an emergency, a nurse will bring the pet into the back and check their respiratory rate, heart rate, temperature, see if there's any difficulty breathing or whatsoever that they can try to attend to immediately, and then shout out to a vet if the pet needs that immediate attention. If the cat appears stable, breathing is calm, there's no open mouth breathing, there's no like obvious bleeding anywhere or whatsoever, then we will let the client know and they will just have to wait in line.
Understand.
So Dr. Katie, I know that today's topic is feline emergency, but I don't have a feline, I only have a dog. So in case of any emergency cases, right, should I bring my pets to the clinic first or should I bring it to the hospital first?
Well, depending on what kind of emergency you're looking at. So for example, if you know that, say for a breathing problem kind of thing, sometimes rushing to a 24-hour hospital might make more sense because they might need to hospitalize, they might need 24-hour care because a respiratory issue can be quite severe. And bringing to like say a general practice clinic, we may end up helping to stabilize first, but I still have to refer you out later on. So may be better off heading to a hospital setting lah. But I guess if you want more like a first opinion kind of thing, we will still have a look at the pet first and then give our advice accordingly. I suppose for me or at our clinic, basically if we think we are not capable of managing the situation, then we'll advise accordingly and get you to go to a hospital so that the pet gets the attention it needs lah.
So as a pet parent myself, right, do I need to, keep a first aid kit at home like human, like they always have a first aid kit at home? So I'm not sure about pet. Do they have it in a market that I can keep at home? So in case of emergency, I can use it?
I think there is, but it will be more like for like, I don't know, external injuries, like soft bandaging, antiseptic solution, more in that sense. Or if you suspect your pet has history of allergies, whether or not you have antihistamines available to give on first hand lah before heading down to the vet clinic. But otherwise, it really depends on what the emergency is. Something inside the first aid kit may be of no use at all.
Okay. And how often do you see feline emergencies?
Luckily not daily lah, but a few times a week we'll have. I guess they do come in waves. Sometimes we will have multiple emergencies in a day, which will get everybody very stressed out. Sometimes we get it sort of a couple times a week, so it can vary.
Are emergency situations usually the most stressful kind of patients that you see?
Well, there will definitely be stress. I mean, we are talking about a potential life at stake. And it's not just the parents are very anxious, the pet parents are very anxious. We sometimes, depending on emergency, we act based on a general guide to say what the problem is and how we will attend to it. But having to work up the case and figure out the cause of problem can take some time. So it can still be stressful. We still occasionally have to flip our books and look at information that's provided and try to match something. Yeah.
Okay, let's move on to a more specific type of emergencies. So we'll start with urinary blockages. So what are the signs that parents should look out for?
Well, urinary blockage tends to happen more with male cats, less so with female. So whenever someone calls in to say, oh, my male cat cannot pee or has been straining to pee, it's more of an emergency. So they might say things like straining to urinate, going in and out of the litter tray very frequently, vocalizing when they are peeing, or I didn't notice any pee at all for the last 24 hours, then it will warrant immediate attention.
What are the common causes of urinary blockage?
For us, I guess there's two main categories. It's usually urinary blockage can be caused by, say, crystals or stones in the bladder or in the urethra that cause blockage of the outflow tract. But it can also be simply caused by some stressful events that can cause inflammation of the wall of the bladder or the urethra that cause a blockage.
Oh, so stress can cause urinary blockage.
Yes, can.
Wow.
Yeah.
And cats tend to get stressed a bit easier as well, right?
Yes, I suppose. Again, depending on the character of the cat. Some of them are a little bit more introvert in that sense, and they may not be well socialized. So loud noises, people servicing the aircon, for example, or the pet parents going on holidays for a long period of time can potentially be a stress trigger.
So what are the preventative measures that cat owners can take to prevent urinary blockages?
So if we say that the blockage is due to crystals and stones, we would usually say recommend to feed a mixture of wet and dry food so that we can increase water intake. So more wet food, provide multiple sources of water to encourage drinking. So for example, some cats like running water. So like a water fountain would be ideal. Then if it's because of crystals, again, the urine pH plays a factor. So feeding certain prescription diets can help manage that pH and prevent stones from forming. If it's because of stress, then it is for us to figure out what that stress factor could be and how we can try to avoid and prevent it. There are certain diets also, or even pheromone therapies that are available to help manage stress.
Okay. And how quickly does a cat need veterinary attention if they're showing signs of?
Immediately.
Okay, so the minute you notice like, hey, something a bit wrong, bring to the vet immediately.
Or you see it squatting, right? And then it only has a few drops of pee. Then 5 minutes later, it squats again and only a few drops of pee. It will require immediate attention because blockages in male cats can be fatal, can be life-threatening.
So once they bring the cat to the clinic, what is done to treat the cat?
So usually for urinary blockage, once we confirm that it's truly blocked, we will need to explain to the client the causes, etc. And they need to be unblocked under general anesthesia. And that involves us passing a urinary catheter up the urethra, up the penis to unblock the cat so that we allow passive flow of urine. And we sort of like rest the bladder by stitching the urinary catheter in place. Usually we leave it in for a few days.
Is this like a long-term solution? For example, for a cat that stresses very easily, would this be like a long-term issue that they will face?
Potentially. So that's why it's important to figure out what that stress factor is and see if we can make changes to manage that stress factor. There are some times where if cats get blocked multiple times over a short period of time, then a salvage procedure called perineal urethrotomy may need to be performed such that we widen the pee hole so that they can have better urine outflow. Yeah.
Okay. And what are the costs associated with this type of emergency and any pet insurance that would help?
The costs can vary between the severity of the condition, how easy or difficult to unblock, and it also varies with the clinics. I would say a very rough average 1 to 3K might be necessary for such situations. Some blockages, like I say, because it's life-threatening and if it's caught a little bit late, they might need 24-hour care, and if that happens, then of course costs will go higher.
Okay.
I do understand that. Nowadays, the bill for operation is very high, so I'm not sure whether Dr. Kitty, have you ever encountered, pet parent, they can't afford to pay for the bill, and, how it helps to help them to lighten the...
There are some clinics that provide interest-free installments. So you have to check with the clinic if they do so. Other than that, I mean, basically, sometimes you will treat the life-threatening component of it. You may not do a very thorough workup, just to help minimize the cost of the bill lah. But of course, that's not as ideal. But sometimes it really depends on each individual situation. You just try your best to manage as best as possible within budget. There are some cases where if it happens repeatedly and the pet parent really cannot afford, then we may have to talk about difficult decisions like euthanasia, should the pet be suffering. Yeah.
So I guess what we also really learned today, something to really take back, is that with emergencies, it's important to give your vet a call, and then the safest is to bring to your vet if you see that symptom persisting.
Yeah, definitely.
Yeah. All right. Thank you, everyone. We've come to the end of the episode. We'll see you in the next one.
Thank you.